This, as you are aware, the national response is at a critical point. We've scored a couple of successes, and we're on the cusp of controlling the epidemic. But so we're at that point where we're beginning to look out for the components that we're leaving behind so that we can catch up on those sectors. And a critical point that we have realized is that we're leaving the young people behind. In the pediatric cases, children, we're not covering them as much as we're covering the adults. And it's for obvious reasons. There are challenges there. And so this meeting, the objective of this meeting is to bring the critical stakeholders that are working in that area, that are focused in that area, to share with us the challenges they are having on the field. What is preventing them from hitting and reaching the targets that we have set out there, with the objective that if we know the challenges they are going through, collectively we can develop a plan to quickly catch up and overrun those challenges. And that is why this meeting, it's of all critical stakeholders that has to do with HIV and TB, as well as that are focused on attending to pediatric cases in Nigeria.
So today is a great opportunity because we're developing an action plan to try to reduce the number of new infections among children in Nigeria. At this moment, in Nigeria is the country number 1 in the world with more infections of children with HIV, more than 20,000 per year. And as well is country number 1 in the number of deaths of children for HIV. So really there is a lot of work to be done, and we need to build on what has been done over the last few years to really look forward and to see how we can prevent this situation. What we hope, is after this 3 days workshop, we are going to have a clear action plan that is going to be able to be implemented as soon as possible. We have the leadership of the government, we have the buy-in of the key stakeholders, and we really believe that all together we can start to implement key actions over the next, starting as soon as early next year, to really reduce the number of new infections among children for HIV.